Hi everyone, welcome to our video on rotator cuff repair recovery. Before we dive in, it's important to note that each surgeon's protocols can vary depending on the procedure. What we'll share today is more of just general guidelines of what to follow after your surgery. Make sure you consult with your surgeon before proceeding with any exercise. Let's jump into the phases of each protocol. So in phase 1 of your recovery, this is right after surgery. You have just had the procedure, you're currently in a sling. The sling will be on at all times from 0 to 6 weeks. You can take it off for very specific exercises, but generally speaking, 0 to 6 weeks is the passive range of motion phase of the protocol. What passive range of motion means is that a therapist or other medical provider is moving you through your range of motion. You are not allowed to do this on your own in the first 0 to 6 weeks, so a therapist or another provider has to move your arm for you. In this phase, the focus is tissue healing. So it's important that we're not moving that rotator cuff because those anchors are in place for a reason, and we don't want to detach those anchors from the humerus. You will need to wear your sling at all times during this phase of recovery, so even when you're sleeping. I know it can be uncomfortable, but this protects the shoulder joint and the rotator cuff repair. Once you have completed that 6-week-long phase, you'll move into phase 2, which is between 6 and 8 weeks. This is where you can start moving the shoulder with assistance from a device. Active assistive means we need assistance using another device or your other arm to move your arm. In this phase, you can remove your sling and allow the arm to dangle by your side. It's important that you don't move that operated side on its own yet. That will be in phase 3. In this phase, we're progressively building your range of motion at a slow and steady pace. You don't want to force it too early on. Your therapist will guide you as far as how much range of motion you need in this phase. Now we're at the 8-week mark. We now can move into the active phase, which means you can start moving that shoulder on its own. We want to, of course, start very gradual, but this is the phase where we start to build the active motion, like reaching and moving in certain directions on your own without assistance. This is generally from 8 to 12 weeks. We want to eventually get to that full range of motion during this phase. And the final phase at week 12 is the strengthening phase. This is where we start to actually apply resistance to the shoulder using weights, resistance bands. This is where you start to feel more normal again. Before you were limited by your strength, now we're starting to build that up to start doing normal tasks like you did before the surgery. At this phase, you should be at full range of motion. If you have some minor restrictions, that's okay. You want to reach that full capacity as soon as possible. Now, in each phase of recovery, there are specific exercises. We won't go over those today, but we will address those in a separate video. I know this recovery phase can be long and lengthy. If you have any questions, please comment below. We'll be happy to address those. And of course, like and subscribe and follow our future content. Thanks so much.